Okay.
I'm here live with Dr. Harry Adelson, my favorite stem cell guy, man. This guy saved my life, honestly. And if you haven't seen the videos where you see all these needles down my spine and everywhere on my body, go to my Cellular Healing TV on my website and you will see it. It was not that long ago that we posted it, but put the word stem cells in, you'll watch that video. Pretty impressive. You'll see some neat stuff. But dude, you're the man. You've done more stem cells injections on anybody, man. I mean, that's what Dave Asprey, me, Ben Greenfield, who I brought here, all of us came to you. So look, I'm here just as a follow-up to maximize what you did in my spine. And I mean, I can touch literally my hands on my feet without pain now. So thank you, man.
That's great. That's terrific.
Thank you. I mean, you'll see. He does something called the full body, where literally every joint in your body, my face, my wife who's behind the camera right now, wait till you see her facial. It's in there in the interview because we actually have live videos in that interview on Cellular Healing TV. But today, I want you to tell them about something I'm getting done. To maximize those procedures, I wanted to do it after a fast. So this is day 6 of my fast. I haven't ate yet. My stem cells are super high. My body's using them. So what I'm doing here to maximize what you did is I'm injecting IV exosomes. What the heck are exosomes? Tell them.
So exosomes are, so let's go back to Cellular Biology 101 and we look at the diagram of a cell. And first you see the membrane of the cell. So that's what's, everything that's within the membrane is the cell. And you have the organelles. The biggest organelle is the nucleus, and that contains the genetic material. But then you have the Golgi apparatus, and then you have Dave Asprey's favorite, the mitochondria. And
My favorite too.
That's right, and you have all these different organelles, and then you see these little vesicles, and they're called exosomes. And when we were in school, they used to tell us that
cellular rubbish.
They used to say that was the excretion, that was the metabolic waste. That was how cells got rid of their cellular poo-poo. But actually what that is in the case of stem cells is those are the growth factors that are the intercellular communication. That is the currency of the stem cell. When the stem cell exerts its paracrine effect, when it's able to identify that it's in the presence of damaged cells, and in response it releases growth factors that trigger the healing of that cell, that fight the invading microbes and control the inflammation. That is in fact those exosomes, those vesicles filled with growth factors. And what makes your stem cells and my stem cells, 50-plus-year-old stem cells, what makes our stem cells aged stem cells is they lose the ability to produce those exosomes. That's what an older exosome does. So what this Chimera Labs does is they take placental stem cells, which are the most robust stem cells that there are. They culture expand them. They put them in a stressful culture medium, so they sprout. They sprout all these exosomes. They then destroy the stem cell, get rid of the other person's genetic material, so you're not taking that person's...
So this is safer. It's the safest thing.
Right, you're not taking that person's genetic material. They just harvest the exosomes. So now we add that to, like your treatment, we added it to your own bone marrow stem cells. What that does is your own stem cells absorb these exosomes into themselves, so it's turbocharging your own stem cells.
Yeah, that's cool. So that's what's happening. We're literally just powerhousing the other treatments that we did. But I believe, doing this post-fast when all my own stem cells are ready to activate, all right, I'm a little old, so my viable stem cells and exosomes are lacking, so we're boosting it to the moon right now.
That's right.
Yeah, I mean, it's so cool. There's only a few people doing stem cells in the world right now. I mean, this is new technology. I mean, I've done a lot of research on it now. I mean, literally within the last year, maybe year and a half, I mean, that's all I've come up with as far as literature.
When I started doing it in 2010, I could name everybody in the U.S. who was doing it. There were like 10 guys doing it. I knew them all. And now, in the last few years, it's exploded. But there's
stem cells.
Yeah. But there's still a small number of people who do intradiscal injections, epidural injections.
Yeah, but that's because you have this technology where you're going in, you're watching. I mean, wait till you see the video on Cellular Healing TV because you'll see him going in exactly where he needs to go. And then the cool thing is you see the stem cells literally going to the problem areas. It's really cool.
That's right.
Yeah, it's really cool. So exosomes, one of the few people doing them. This is new technology. Make sure, when you see the video, you'll see how to get in contact with this guy, because many of you, he's the bomb. That's why we all come here. Park City, Utah. I was actually heading to Miami to get it done, and someone was like, this guy that interviewed all the experts on this, he said, you need to go to Harry. Then I
right
found
down the
out
street.
who you were. Yeah,
Harry,
exactly.
speak to your niche, because you don't do certain things, but there's things that you
Right.
focus on. So make sure that's
He's the pain
clear.
master.
So we treat chronic musculoskeletal pain with a focus on spine pain. So our practice really is the treatment of low back pain, neck pain. We also do joints, but really our focus is low back pain and neck pain.
Yeah, and he does some unique things. Again, I didn't even cover them all. Watch the video on Cellular Healing TV. Hey, I'll see you tonight. Wait till you see the food, man. I'm telling you. Wait till you see this
Don't
food.
get too excited, although you haven't eaten in 5 days.
Yeah. I'm really excited. This is day 6 of
Half
fasting,
an
man.
avocado.
Yeah, don't take the rain out of the thunder here. The thunder
Now I'm
out of my
excited
rain.
for all you all.
Yeah, that's
I
right.
did this last month.
I'm excited, man. I love this group. I really do.
Yeah.
So we have a really exciting video for you tonight. So stay tuned for that. I'll see you then.